Good morning everyone. Today's topic is pterygium. So when you see a case of pterygium, you'll see that usually it occurs in old age people and people who are doing outdoor work. It is more common in people living hot climates and who are exposed to sun, dry heat, high wind or abundance of dust. So on a history or rather on occupational history, the patient will be farmer or a roadside construction worker, like that. So this is a pterygium. So pterygium is usually a fold of conjunctival tissue growing or encroaching over the cornea. So this is how it will look, and it is a wing shaped, so hence the name pterygium. So the patient's chief complaints in a case of pterygium will be cosmetic intolerance, and like they will say that they can see a mass encroaching over the cornea, and that's it. Visual disturbances can occur if the pterygium is encroaching over the pupillary area, or there can be corneal astigmatism induced by fibrosis in the regressive stage. There can also be occasional diplopia, but that is rare, and it occurs when there is involvement of the ocular movements and ocular muscles, which leads to limitation of ocular movements. So on examination, it can be unilateral or bilateral, and this is a you can see as a triangular fold of conjunctiva encroaching on the cornea in the area of palpebral aperture. So usually it grows on the nasal side, and in some cases you can see a Stalker's line, that is due to deposition of iron, and when the cap over the pterygium is not present, then you can see the Stalker's line. It is just anterior to the head of the pterygium. So discussion. So what exactly is pterygium? Pterygium is a wing-shaped fold of conjunctiva encroaching upon the cornea from either side within the interpalpebral fissure. Pathology. It is a degenerative and hyperplastic condition of the conjunctiva. So subconjunctival tissue undergoes elastotic degeneration and proliferates as vascularized granulation tissue under the epithelium, which ultimately encroaches over the cornea. In this case, the corneal epithelium, Bowman's layer, and the superficial stroma are all destroyed. What are the parts of pterygium? Parts of the pterygium are head, neck, body, that that is a scleral part which extends between the limbus and the canthus. I'll show it in the diagram in the next slide. What are the types of pterygium? Pterygium can be regressive or progressive. So progressive pterygium appears to be thick, fleshy and vascular with a few infiltrates in the cornea in front of the head of pterygium, which is called the cap of the pterygium. And regressive pterygium is thin, atrophic, attenuated, and very little vascularity is present, and in this case there can be the presence of Stalker's line, and the regressive one becomes membranous and may later disappear. So these are the parts of pterygium. The head of the pterygium is present on the cornea, the neck is present in the limbal area, and body extends between the limbus and the canthus over the scleral part. And the cap is a semilunar whitish infiltrate just in front of the head of the pterygium. Also, we can divide types of pterygium as depending on the distance from the see, if it is type 1, if it is just touching the limbus, type 2 is between the limbus and the pupillary margin, then type 3 is on the pupillary margin, and type 4 if it crosses over the pupil. So, what are the differential diagnosis? So, differential diagnosis is pseudopterygium. Pseudopterygium is nothing but a fold of bulbar conjunctiva which is attached to the cornea. It is formed due to adhesions from chemosed bulbar conjunctiva to the marginal corneal ulcer, and it is usually following chemical injury of the eye. Now, how will you differentiate? So, etiologically, pterygium is a degenerative process, while pseudopterygium is an inflammatory process. And pterygium usually occurs in elderly age, but pseudopterygium there is no like age preponderance. And site, the pterygium is usually present in the palpebral aperture. Pseudopterygium has no particular site. The stages, pterygium can either be progressive or regressive or stationary, and pseudopterygium is always stationary. Now, how will you differentiate clinically between pterygium and pseudopterygium? Is by doing a probe test. So, probe test is nothing but passing the probe under the tissue, under the pterygium. So in the case of pterygium, the probe cannot be passed underneath, and in case of pseudopterygium, a probe can be passed under the neck of pterygium. So as we see here, this is a pseudopterygium, so the probe can be easily passed below it. So it is diagnosed as pseudopterygium. Now, what are the complications of pterygium? So, if the pterygium is untreated, or if it progresses, there can be cystic degeneration, or there can be infection, and rarely there can be a neoplastic change leading to epithelioma, fibrosarcoma, or malignant melanoma may occur. Treatment. So if the patient has less complaints, then you can opt for lubricating eye drops, and that's it. But what are the indications of surgery of pterygium? So surgical excision of the pterygium can be done for cosmetic reasons. Then if there is a continued progression of the pterygium which can encroach over the pupillary area, but if the pterygium has crossed half the pupil, then you have to wait for the pterygium to cross over the other side, and then only you have to operate. Then also if there is a complaint of diplopia due to interference in the ocular movement, so in these cases you can go for surgical excision of the pterygium. But then after surgical excision, there are chances of recurrence. So how can you prevent recurrence of pterygium? So you can do surgical excision with free conjunctival limbal autograft, or you can do surgical excision with amniotic membrane graft or mitomycin C, and surgical excision with lamellar keratectomy and lamellar keratoplasty. So these are the ways you can prevent recurrence. Thank you.